All right, I think that's about enough time to start. Okay, so hi, I'm Dr. Dan, and I'm going to be presenting today on what is a chiropractor. So I'm presenting, but I'm also going to be running the show. So if there's any technical difficulties, that's my fault. If there's anything wrong with the presentation, also my fault. I take full responsibility for tonight, but if anything goes right, I'll take that credit as well. Okay, so like I said, we're going to be going over what is a chiropractor, what do chiropractors do, and how do they fit into your overall health plan and health programming. So the reason that I created this webinar in particular is I've actually done quite a few webinars in the past, and each time that I created one of my previous webinars, I'd always start with a little brief introduction of what chiropractors are, and then inevitably my webinars would always end up a little bit longer than I wanted. And the first thing that I would chop was what is a chiropractor and what do they do? And it happened one too many times. And I've realized I should just do one webinar on what this is. The other reason that I'm doing it this way is I've heard quite a few questions, both directly and indirectly at the clinic. So I just wanted to be able to answer some of those questions and go over it and be able to put them here on video so that anyone that is watching this can kind of reflect back and see my answers in person and actually hear how I respond to some of the common questions that happen in the clinic. Okay, so the things that we're going to be going over today is what is a chiropractor? So we're actually going to start with a little bit of a history and evolution of the chiropractic profession. I will make that part brief, but it's a little dear to my heart. I really enjoy that part, so we're going to go over it. And then we're going to talk about what chiropractors treat, and more importantly, what they don't treat. Then we're going to talk about how chiropractors treat, so some of the tools that we use. Finally, I'm going to answer some of those questions that I mentioned that I hear pretty often in clinic. And at the very end, if you guys have any questions, I'm happy to answer absolutely anything that you guys want to know. While we're going through this webinar, if you guys have any questions, you just want to put them in the chat box. I'm going to finish the webinar and then I'll go back and actually answer the questions. But if you want to put them in there, that way they're saved and you don't have to remember them for the end, that's totally fine. And then they'll be there and I'll answer them. All right. So the evolution of chiropractic. So the actual word chiropractic or chiropractor, it's derived from two pieces. So chiro meaning hand and practic meaning done by. So if we switch them, it means done by hand. So chiropractors typically treat with their hands. But at their actual root, what chiropractors actually do is they're manual therapists. So what that means is they use some sort of force and they apply it to the body with the hope of creating some sort of therapeutic outcome. So either making you more healthy or getting rid of pain or increasing your function. And those forces can come in a variety of formats, right? So some of the forces that are really common that I offer are, I'll send you home with stretches and exercises. That's a force. Sometimes I will adjust the patient. We're going to talk about what an adjustment is, but that's a force. Sometimes I'll use acupuncture or I'll use vibration therapy, hot and cold amount to a force, laser, ultrasound, all the kind of different therapeutic tools that we have and we use as chiropractors, all forces we apply to the body in the hope. So manual therapy actually has its roots all the way back to Hippocrates, which is the father of medicine. That's where what you know today as medicine kind of evolved out of. And actually there's some writings and drawings of manual therapy actually being done before Hippocrates. So I put a picture in here. This picture is actually a little bit after Hippocrates, but it's just an example of people using some sort of force. You can see there some guys being pulled apart while some people are walking on his back, applying a force to the body with the hope of creating some sort of therapeutic effect. Not sure what they were going for there, but we use things like this today. So over the years, manual therapy has kind of shown up in different civilizations and in different uses and forms, but the actual chiropractic profession didn't begin until 1895, which is about 125, 126 years ago. So it's actually a relatively new profession in comparison relative to some of the other medical professions. For those of you who are familiar with Kawartha and surrounding area, the inventor or discoverer or whatever you want to call it of chiropractic, the very first chiropractor. I believe he was born in Pickering, but he's actually from Port Perry, which is not that far away. And if you're ever in Port Perry and you drive around for a little bit, you can actually find a statue of his name's D.D. Palmer. There's a statue of him somewhere in that town. So In the beginning, D.D. Palmer, the creator, inventor, discoverer of chiropractic, used to use something called an adjustment, which we're going to talk about. But over the years, over the last 125 years, chiropractic has kind of changed and morphed. And there's two really big components that have happened over the last 125 years to the profession of chiropractic. Number one is we've diversified. So we don't just use adjustments, but we use all sorts of other tools. Some of them I've already mentioned, and we're going to go over a whole bunch later on in the webinar. And the other thing that we've done is in the beginning, the chiropractors, D.D. Palmer and his disciples, would treat, they'd use adjustments, their patients would get better. That was excellent. So they'd treat more patients and more patients would get better. And that was also excellent. But they, over time, realized that we need to have some sort of literature, some sort of component to show what we're doing has an effect. So one of the biggest things that the chiropractic profession has done over the last little while is really dedicate a lot of time and energy and research and resources into research to show the efficacy of what we're doing. And there's a really good body of research to show how powerful chiropractic treatments are and can be. And finally, to actually become a chiropractor is not such an easy task. After you graduate high school, what you do is you go to university and you get an undergrad degree. Usually takes about 4 years to complete one of those. And if you're successful, then you can apply to chiropractic school, which then takes another 4 years of schooling to then become a chiropractor. And if you really enjoy pain and studying and late nights and all-nighters, you can then go on and do a specialty or residency. There's 3 different kinds of residencies in chiropractic, which can take anywhere from 2 to 6 years, depending on what you go after and the pathway that you take. So some chiropractors will be studying for up to 12 to 14 years before they actually become a chiropractor. So that's the evolution. The big thing that most of you came for tonight is going to be, what do we do and how can we help you, right? So I hope you guys like color. I don't know what I was thinking last night, but I put a lot of color on all these slides, so enjoy that. So here's a list. This is not an exhaustive list of everything that we treat, but it is a general list. In here, you can see some things like neck pain, back pain, low back pain. So those are symptoms. You can also see different things like carpal tunnel or golfers or tennis elbow. So those are actual diagnoses that we treat. And some other things that I put in here, I threw my back out, or I've got a twisted knee or a rolled ankle. So sometimes patients will come in and tell me that these are some of the things that they've done to themselves. And typically we can treat most of the things that go along with that. So how can you think of the spectrum of the things that chiropractic treat? Well, there's a term that describes chiropractors pretty well, and it's the thing that we kind of describe ourselves as, and that would be a neuromusculoskeletal specialist. So that's a long, complicated word, but we're going to break it down. So if we start with neuro, right, nervous, so anything to do with nerves. So most conditions that relate to nerves, we can treat. And then when you look at musculo, so those are the muscles. So anything to do with muscles and tendons, we also treat that. And then the biggest one is the skeletal. So anything to do with the skeleton. So when you think of skeleton, of course, you're going to think of the bones, but then you muscles, the labra, cartilage, meniscus. So basically fascia, all the connective tissues that hold you together. So it's a pretty broad spectrum. And actually that spectrum encompasses about 90% of conditions that patients have or come in with. 90% of the injuries, even over 90% of the injuries relate to one of those areas of the body. And so it's actually easier, rather than thinking of the things that we do treat, it's actually easier to think of the things that we don't treat. So that's a preferred way that I use to describe what we can and can't treat when someone asks me. So if you think about the things that we can't treat as chiropractors, that's going to be basically anything to do with an organ. So most of the time, we can't treat things to do with intestines and stomach, liver, kidneys, pancreas, appendix, if that's an organ, the brain, so mental health type stuff we can't treat. Now with the brain, there's a bit of an area that we do treat is headaches and concussion, or more specifically post-concussive symptoms. So any symptoms that happen after getting one or multiple severe concussions. But as a very broad spectrum description, what we mostly treat is pain. So anytime that you have some sort of pain, it's worth at least having a chiropractor look at it, check it out, see if we can help. And when patients come in pain, my goal is to obviously help them get out of pain, But the other thing that I really find super important to apply is to try and help them with function, right? So if I have, let's say, an elderly patient with knee pain, of course, I'd love to help get them out of that pain. I'd love to make sure that they don't have any knee pain, but I'm actually more concerned with what is that knee pain doing to their day-to-day life? Are they able to climb stairs or get in and out of a car or sit up from a chair, right? They sit down on a really low toilet, can they get back up? So as much as the pain is a focus, and that's something that we try to take care of, it's actually the function side of things that I'm way more interested in helping to make sure that we keep up with. One of the things that Kawartha Care does really well and offers is 15-minute free consults. So if you're ever unsure if a chiropractor can help whatever you have going on, just book in for one of our virtual consults. We'll have a chiropractor either do a virtual call with you, or we sometimes phone you if you prefer that method. It's just 15 minutes, complimentary. We'll have a quick discussion, ask you a few questions just to see if you're a candidate for chiropractic care. And if you're not, typically we'll recommend, hey, I don't think we can help you with this, but you're going to want to go speak to this kind of medical professional, or maybe go see this person. And that's one of the beautiful things about Kawartha Care is we have so many other healthcare providers in the clinic. So we have massage therapists, we've got talk therapists, we've got physiotherapists, we've got all sorts of other different kinds of healthcare providers. And so sometimes we refer on to them and get your help that way. So that's what we treat. Now, what do we do? How do we treat it? So again, color. I don't know what I was thinking last night, but enjoy. So here's a list of our major treatments. Now, this is not an exhaustive list either. This is not everything, but these are some of the major components of what I use to treat. And I've actually put this in a very specific order. So going down those major colored bars, that is the order that I prefer to use these treatments in. So if I, for example, had a patient come in and I was told, Dr. Dan, you can only use one treatment to help this patient, nothing else, just one treatment. The first thing that I'm going to go with is education. All right, hands off, I'm not going to touch the patient, not going to get near them. I'm just going to teach them everything that I know. I have some brilliant patients and they all seem to really understand the information that I provide to them. So I just want to teach them about the condition they have, their treatment options, what can be done for them, why that's going to work for them, why it's important, what can't be done for them. And under the education umbrella, one of the most important parts is I often find just treating a patient, that's not necessarily going to get them better. What is the most important for patients in the education umbrella is we want to try to remove whatever the core item is that's causing whatever their condition is. So for example, I'm currently treating a patient. He's a house cleaner, so he goes and cleans houses, and that requires a lot of bending over, right? And so every time he bends over, that's stressing the back, that's putting pressure on the back. So a lot of the education component that I'm giving him is tips and tricks on how to properly bend when he has to, and also anything I can do to help him not bend whenever possible. So that's a lot of the education. And I find that if you don't remove that core underlying factor, patients are just gonna keep having the same injury, the same pain, the same condition, the same problem. So once we're through the education component, which then we go on to exercises and stretches. And this is the second most important of any treatment program that I'm putting together. So within the stretches and exercises, there's always a very specific set that I follow. The first thing that we want to do is stretch things out, get things moving, open things up. And then we'll typically go on to a strengthening. So if you have a condition, usually if you have some sort of pain, you tighten up, you stiffen up, it's a little harder to move, right? So we'll stretch things out, get you moving a little bit. That usually takes care of the pain. But then after that, we want to go on to like a strengthening type program. And what I find is the strengthening program, while you're typically out of pain when you get to the strengthening program is what we use to try and ensure that whatever condition you have doesn't come back. Because once you've had a condition, you're typically predisposed to having that condition repeat and happen again. After that we go on to the manual care. So this is what chiropractors are probably most known for. So we'll list them off here. We've got adjustments and acupuncture. Those are the things that I use the most. Soft tissue work, which is like a very targeted massage. And sometimes I'll use a cream called BioFreeze, which is like a cooling cream, feels really nice. I'll also use vibration therapy. So I brought this guy here today. This is called Theragun. It's a powerful vibration tool. Run it up and down any tight muscles that we have. It's really good at making you feel great. Sometimes I'll use athletic taping. Sometimes I'll recommend hot and cold. Sometimes I'll use instrument-assisted soft tissue therapy, which is scraping along the skin just to try and break up some of the scar tissue. I'll use ultrasound, laser, TENS. So these are all just different variations on forces that I can put in the body to try and get a therapeutic effect. Now, the one that I did want to talk a little bit about is adjustments. So most people, if you've seen a chiropractic video or chiropractor treating, you'll usually see a chiropractic adjustment. But for those of you who don't know what that is, essentially, if you think about someone cracking their knuckles, as a chiropractor, we're trained to be able to deliver that, to make that cracking sound, that popping noise, happen to almost every joint in the body. There's a couple joints that are fully fused that will never pop or crack, but we can adjust all the other joints in the body. So along the spine, the shoulder, the elbows, the wrists, the hands, the fingers, hips, knees, ankles, anything you can think of a joint that moves, we can typically adjust it. And the adjustments are great for increasing range of motion. They've been shown to decrease pain, not just in comparison to placebo, but also in comparison to other medications. And they also help with basically how the brain communicates with the muscles and controls the body, something called proprioception. And finally, we use different supportive devices. We offer orthotics. We prescribe and create orthotics. We offer compression socks, braces, and sometimes in some cases, I will send patients out to have X-ray imaging, or sometimes I refer them to other healthcare providers as needed. So that's the basis of our treatment and what we offer and what we do. So let's go on to some of these myths or questions that I've seen or heard indirectly around the office and from patients before. So the first two, number one, do I have to get adjusted if I see a chiropractor? And number two, do I have to receive acupuncture treatments if I see a chiropractor? And the answer to that is a resounding absolutely not. No. I'm going to say that again. You do not have to get adjusted. You do not have to receive acupuncture if you come see a chiropractor. And in fact, if you don't want it, I have no interest in offering it to you. I don't want to be treating you with anything that you don't want. This is a dealer's choice situation. I have all those treatment options that you saw there, and I have so many other. I got so many tricks up my sleeve. If you don't like these two treatments, we have other treatments we can go into. So no. Next one, do adjustments hurt? So the quick answer to that is also no. Adjustments don't typically hurt. Now, if you come in with, let's say, neck pain and you're stiff and tight and you're not really able to move around very much and those muscles are hanging on, and I go in there and I try to offer an adjustment, if those muscles are hanging on and tight, I am not able to offer an adjustment, so I will not. If I tried to adjust you in that state, yes, that would probably hurt, but I am trained highly to make sure that I feel those muscles, and I'm judging to see if you can actually turn those off and if you're able to receive the adjustment. And if I don't think that you're able to turn those muscles off and receive the adjustment, then you will not be adjusted that day. It's just not safe to do so, and it would only create you more harm. So we avoid it if it's going to hurt. So in general, adjustments typically do not hurt, no. All right, once I start getting treated by a chiropractor, do I have to keep getting treated by a chiropractor forever? So this is one of the questions that I hear most often. And the answer keep coming to get treated forever. So there are some patients that I have that do get treated for that on an ongoing basis, which we're going to talk about. But typically, if you're being treated by a chiropractor, you do not have to. And in fact, it wouldn't make any sense even in the business model on our end to be doing that. If I had a patient come in and they had some sort of pain or condition and I was treating them and they were starting to get better and I got them all better, and then I tried to convince them to come back to keep seeking treatment even though they're completely better, well, number one, they're not going to see the benefit. If they're already better, then what benefit are they actually going to receive out of coming back? But as I continue to do this, as I continue to try and convince this patient to keep coming back, well, eventually that patient's going to stop coming back altogether. And then next time they're hurt, they're probably not going to be interested in coming back and receiving care from the chiropractors here. And they're definitely not going to be recommending friends and family to come receive care when their friends and family get hurt, because they don't want to send their friends and family to someone who's going to convince them to just keep coming back. Now, that said, there are some individuals who do keep coming back on a consistent basis. And those individuals, actually a good example is the individual that I mentioned before, that patient that I have that is a house cleaner. He cleans houses and he's bending over all the time. And for him, he is constantly bending over. And as much as we've tried to reduce and remove the inciting force that's causing him the pain, the bending over, we've given him some tips on how to not have to bend. We've given him some tricks on how to bend safely. For him, it's just a part of his job. And until he changes jobs and quits and goes to a new career, it's just something he's going to have to continue doing forever. And so in his case, he actually finds that having adjustments once a month, along with the at-home stretches and exercises and the education that we provided, seems to keep his pain levels at a manageable place. Now, he finds that to be beneficial both financially and time-wise. So he has decided that that's the kind of care that he wants, and that's the kind of care that I am happy to provide. The other kind of patient that I see on an ongoing basis are individuals who are coming in for not sick care, so not individuals that are sick or hurt, but wellness patients. So those are individuals who are totally healthy, but are looking to improve their health. So you can think about that as, if we looked at someone who's sick and healthy, those, we can usually tell the difference between those two. But on the spectrum of sick, you can have someone who has something like a mild cold and someone who has terminal cancer, right? So those two are both sick, but one is obviously significantly more sick than the other. The same thing can be applied to the spectrum of health, right? So if we look at individuals who are healthy, they have no pains or aches or anything like that, we can still look at them and grade them based on how healthy they are. So for the average person who's probably sitting at home and watching this, if you compared yourself to maybe someone who's training to be an Olympic athlete, you might say, okay, well, that person's healthy, eating right, a constant care, and all these therapists watching over them. Their health is probably significantly better than many of ours. And so in that spectrum, there's another side of health. And so I help individuals try to increase their health on that end, if that's what they're coming in for and if that's what they're looking for. Next, do you need a medical referral to be seen by a chiropractor? So the answer to this, like the rest so far, is no. Except there is one caveat. I have never actually seen it. You can call and book in and get treatment anytime you want. That's no problem. But if you are looking to go through insurance and your insurance requires that you have a medical referral from a medical doctor to see the chiropractor in order to receive the coverage from the insurance, then yes, you may have to get a referral. However, in the hundreds of patients and thousands of treatments that I've delivered, I have never seen that so far in an insurance plan. So it's incredibly rare and probably unlikely that your insurance plan has that, but always worth the check if you have access to the insurance plan. And lastly, do chiropractors treat only adults? So the answer to this is, like the rest, no, we do not. We treat all ages. My preference in terms of the individuals that I like to treat are anyone who is able to tell me if they have pain. So that's the spectrum that I like to treat in. So as young as anyone who can indicate that they have pain, and yes, after the treatment they felt better, or after the treatment they felt worse. Now, that said, there are individuals who treat infants and very young children who can't indicate that, and there are some benefits that they have found with those kinds of treatments. So if that's something that you're looking for, as long as you know exactly the kind of outcome that you're looking for in the treatment, then that's something that we definitely offer here at the clinic. All right. I'm just going to see if any questions have come, and I will start answering. And if any of you guys have questions at home, feel free to type them into the chat. Good. So I will sit here for about 3 minutes and just see if any of them show up. Yep. Yes. So I've had one chat come up here saying, please mention that you also help individuals with TMJ dysfunction or jaw pain. So that is definitely something that we offer. The jaw is a joint. And if you have any pain within the jaw, that is something that we can help. We also look for clicking, locking, all sorts of other conditions that can be associated with the jaw and with the TMJ. And on that note, actually, the very last webinar that I gave was on TMJ. It is excellent. So if you have a chance, hop on the YouTube page that Core Care has up. You can go back and find my little TMJ webinar, and it explains everything that I can do for the TMJ, everything that I look for, some of the things you can look for at home, some of the at-home stretches and exercises that you can do, and all the other things that we can offer you. Thanks. All right. Well, I think that's all the questions that we have. We've got a few people that have popped out. So for everyone at home, I hope you guys enjoyed that. I hope it was educational and informative. If you have any questions, we always have those 15-minute complimentary phone calls you can book in. I'm happy to chat about anything, any questions that you guys might have. And we have all sorts of other services at the clinic that offer similar type treatments. Thank you guys for being here tonight. I hope you enjoyed, and we'll see you around the clinic. Have a good night.